my own personal best.
It happened on August 23rd. It was pretty much a regular day, and all the days leading up to it were pretty normal. I was outside in the warehouse looking at some product that got wet in shipping. So after inspecting that, I was leaned over and checking it out, and then it just happened right after that. I remember coming to later on that day and just being like, what the hell happened? And then everybody's like, well, you had a seizure.
The AVM was fairly large. First of all, it was dangerous because the patient developed sudden onset of seizures and never had a seizure before, and developed severe headaches. So these are warning signs that something's happening in the AVM.
The AVM basically is a mass of veins and arteries that are blood vessels that are all clumped together. From what I understand, a lot of people don't actually make it past the first seizure because they do hemorrhage right away.
The approach that we use here, MCVI, and in North America most successfully, is, when possible, embolization followed by surgical resection. So you close the AVM as much as you can, so when the surgeon goes in, he doesn't have to deal with the hemorrhage. The AVM comes out like a solid block, almost like a benign tumor. The embolization was very successful. I closed the AVM almost completely, almost like a cured by embolization alone. And then went to surgery, and surgery was successful. The AVM was completely resected. We did a follow-up angiograms after the surgery to demonstrate, to prove that the AVM is completely gone. And this patient is doing very well. I had some minor headaches, but basically back to his self.
They basically saved my life. I honestly wouldn't be here if it wasn't for them, because more than likely I probably would have had another seizure, which would have been a bit more dangerous. It could have led to brain hemorrhage. So for sure, to the entire team at Baptist, I can't say enough. I'm forever grateful to them.